Hi, I'm Dr. Julie Steinauer. Let's talk about hypertension or high blood pressure and strokes can affect your vision and what happens with those two conditions. Now, hopefully by now everyone knows what hypertension is and they are having their blood pressure monitored closely. Maybe you are able to keep it diet controlled, which I hope. In some instances that might not be possible or it might not be a good option for you, and so obviously medication control could be an option. Now, if blood pressure is left unchecked for a period of time, it's going to affect vision, and we notice typically tend to see a dimming of eyesight. So we can either have dimming or blurring of eyesight, or even potentially have like an area of vision that's lost, depending on what's going on. Now, if hypertension also goes unchecked, it can tend to cause a stroke. Some of the signs that are really important for you to be aware of if you or someone may be having a stroke is that you may notice double vision, a blurring out of vision. You may notice that all of a sudden you're slurring speech or having a tough time talking. You may notice weakness, facial weakness, or weakness in an arm or a leg that could be one-sided. Tingling sensation also can occur. Looking to see if there's anything else I want to highlight. There's many symptoms of that. I really encourage you to look those up and be familiar with them, as it's super important to be able to kind of notice whether or not you have potentially had a stroke or whether you might be having one, and to get to the hospital right away, get to the emergency room. Now, how do we treat these conditions? If you have hypertension that's affecting your eyesight, or you've had a stroke and it's affected your vision. Now, we're two ways actually. One is that we use photosynthonics, also known as syntonics or light therapy, in order to electrically trigger the brain to turn on areas of vision that may have been kind of turned off. Depending upon where the stroke is occurring within the brain or even in the eye, can play a big part as to not only what your symptoms are and what's happening with you after the stroke, but also how we can treat you. So a stroke, it's typical to see either motor delays, which might mean a problem with weakness on one side of the body, or maybe it's just an arm, or maybe it's just a hand, or maybe it's just a leg that you have weakness in, or it could be down one whole entire side. So there's motor delays, there are cognitive delays, like thinking skills being affected, memory being affected, and speech and language can also be affected, and also sensory. So vision obviously can be something that is affected. In vision, there are several things that can go on. You can have decreased eyesight, like a dimming or blurring of eyesight that stays around. You can also have areas of your sight go missing, like your visual field has blind spots in them. In particular, in some cases, a person could potentially lose even one half of their visual field, like the right half is gone for each eye, or the left half is gone for each eye. It's also possible for people to be experiencing what we call visual neglect. Due to the area of the brain that's affected by the stroke, they may actually neglect one side of their face or one half of their body. And it sounds somewhat interesting, maybe a little bizarre, but you can have someone who be a woman who would take care of herself, put on her makeup, and then just ignore one half of her face. Or a man with shaving would just ignore one half of his face. Obviously, we know that the vision factors that come after a stroke can be potentially very devastating to an individual, depending upon, again, which area of the brain had the stroke. Now, what do we do to correct this or work with it? Because we actually do work with patients who have hypertension that's affected their ability to see clearly, and also patients who've had a stroke. So we utilize Syntonics goggles. These have different colored filters in them. But basically, the person puts the goggles on and they look at a light source. There's some very specifics on this that we want you to do, so we're not telling it all today. But you put on the goggles, you look at the light source, and what happens is the filter color triggers different areas within the brain. So it's important if the area of the brain that maybe you had the stroke in and it went without oxygen and blood flow, and kind of a lot of times is considered to be not viable or even dead tissue, which I hate to hear that word, but that's a lot of times what people will say about the area, that went without oxygen and blood flow for a while. The Syntonix goggles are designed to actually increase blood flow back into all areas of the brain and also cause nerve connections or nerve impulses to occur again where maybe they weren't able to occur because, again, the stroke has affected that area and caused it to not perform the same as it did before. So Syntonix goggles can kind of increase blood flow and nerve transmission into that area. And that's where we can be pretty successful in returning some vision. It does depend on the amount of time that's lapsed in between, although we've got cases of patients we've worked with who 10 to 12 years later have come in and had really successful recoveries of their vision and visual field. And we've had cases where patients have had successful recoveries of their vision within just a couple of months. But we've also had cases where it's not gone as successfully as maybe we wanted. Most of the time when this happens, we tend to find out that it's an individual who's really been affected to the point where, you know, their self-esteem and their self-confidence has just really taken a plummet. Maybe they don't have a caregiver who can actually work with them and help them, and they're trying to do it on their own. So mindset and the ability to have someone helping you with this is really crucial to your recovery. And we have awesome results for those patients who have, you know, success in keeping a positive outlook on everything and also having someone who can work with them and be very dedicated in pushing them to be able to gain their vision back. And we've had varying results. We've had results where we've gotten 10% of vision back, and we've had results where we've gotten as much as 80% of vision back. And so there aren't always, you know, crystal ball methods of knowing which of those you could potentially get. But again, there are factors that we can look at that tell us whether or not your case has a better chance of gaining more vision back versus not as good of a chance of gaining more vision back. Now, that's just some of the things that we do. The Syntonix goggles are not everything because we also do vision therapy, which is kind of like physical therapy and occupational therapy for the brain and eyes, where we're retraining the brain to process information in that area of the brain again that maybe, you know, kind of it lost touch with how it's supposed to direct the body and direct the eyes. Again, this all is dependent upon where it's occurred at. But there are many things that you can do to restore vision, even motor function, which is more common for people to hear about how to restore things like motor function because of physical therapy and being able to do, you know, normal things again, getting back to normal routine because of occupational therapy. But unfortunately, it's really not widely known that you can actually recover vision too. And that's what this video is really about, is trying to help people and help bring awareness to the fact that even if you've had hypertension, which has affected your eyesight, or, you know, it's gone so far as to cause a stroke, that even if you've had vision loss due to a stroke, there are things that can be done to sensory stimulate the body and brain again, I should say the brain again, to develop more proper vision and hopefully gain back some of the vision that you may have lost. Now, if this video is interesting to you because maybe you've had a stroke, then certainly give us a call if you're local. Our phone number is 618-288-1489, or you can go to our website at visionforlifeworks.com. You can fill out a questionnaire if you're not local to us. So not local to us is not within kind of driving distance to us. And if you're not local, either you have one of two choices. You can either fill out the questionnaire, which will come over to us, and that will take a process of a couple of days to sometimes a week to respond to you. Or you can, if you just want to skip all of that because you know right away that you're very interested in this treatment, you can actually click a button on our website that is a schedule a consult with Dr. Julie. So you can actually schedule a consultation direct with me. Again, this is not the appropriate method we want you to kind of go through if you're local to us. Give us a call because it's easier for us to get you into the clinic. But if you're not local and you can't drive or you're too far away from us, then either schedule the consult with us, or you can fill out that questionnaire and then get you into a process of kind of answering your questions and how we might be able to help you. Now, again, if this video is something that you like, feel free to share it. Definitely like it, and we would love if you'd subscribe to our YouTube channel so that you can get more awesome videos about things that affect your vision. Thank you.